Hello, my name is Luis Miguel Casas, and this is my program evaluation presentation in reference to Social Work 5313, Research and Evaluation and Social Work Methods. So when considering what program I wanted to evaluate and which demographic I wanted to focus on, I thought back to my community here in El Paso, Texas, and thought about some of the issues that we're experiencing here with migration, housing crisis, socioeconomic indifferences, and even economic opportunities, and none of them really stuck with me. I couldn't find a drive or an angle or necessarily the outlet I wanted to express to draw concern to an issue and offer a solution. So I thought back to my roots and I started considering what my focus is right now, which is children and family. And I decided to start looking into what are some of the familiar and child and adolescent issues that are going on in El Paso. At that point, I was drawn back to an article I recall reading in August of last year, in 2023, and it was in reference to the influx of vapes, specifically THC, cartridge vapes, that were being found and used and resulting in adolescents and children being arrested on school premises with felony charges because they are bringing concentrated THC into a school facility. The article goes on to mention how in 2017 the influx began with only 16 minors being arrested across the city, the El Paso city limits. From that point in 2018, it jumped up to 40 children and adolescents being arrested. 2019, it once again repeated the same trend and jumped to 250 child and adolescents being arrested for the same felony charges. There was a small break in 2020 due to the pandemic and the no school session, but there were still arrests during that time period when they start integrating children back into the classroom. From that point, 2021, we saw a minor reduction because that was still during the COVID era where introduction back into the classroom was limited and scarce, but we still had 199 arrests. And then in 2022, finalized 700 total arrests of children and adolescents, which were then put into the JPD system because they brought in THC concentrate in the form of vape, and this does not include those individuals who also brought in nicotine vapes, which is a less severe crime but still results in punishment, of course, to the school. At that point, JPD devised a diversion program for these first-time offenders and first-time arrests, this way to expunge the record and also limit the strenuous resources that would take to send the cartridges out to Texas Department of Public Safety and Transportation and get the results back. Since there's only 2 facilities located in Texas that actually do test for concentrate and puration of THC to then charge the adolescent or child or anyone for that matter, the system became overran, and then there became limited resources, and all these cases were getting backed up and pending years until they're eventually over the age of 18, and then they would have to face the same charges but as an adult then. The JPD system is still going through some issues with that because it is still being overran with an influx, and a lot of the blame goes to our neighboring state, New Mexico, which is maybe 20 miles away from El Paso. Or it's a relative commute, and they recently legalized marijuana in 2022. However, the trial team chief, Director Dawson, reports that this trend was already present. It's just a little more accessible now, unfortunately, because there are individuals who do purchase it and then sell it to minors. For the consideration of this program evaluation, this is going to be more focused around the 3 main districts that are within city limits, which is El Paso Independent School District, Socorro Independent School District, and Isleta Independent School District. These resources that they're putting in place are more for punitive action and reactive when a child has already committed the crime and then needs to be punished and such. One school that is trying to do somewhat of a mitigation is the Anthony Independent School District, who's setting up detectors in the classrooms to detect vape emission. But again, that's more of a reactive consequence. Instead, what I was going to suggest is a proactive approach, which leans more towards the preventative measures. This way we can alleviate the JPD system, we can alleviate the TDPS system, and just focus around educating the public, educating parents, gaining public involvement, and then also educating our youth. This way they're understandable of, some of the risks and the rewards out of it. And risk is used scarcely. uh, Children and adolescents are rebellious and have always been novel and experimental, so this isn't necessarily a new trend. It's just that there's new modes that we are not yet equipped to handle, and the public is not very well rehearsed in place in El Paso to address this issue is the El Paso del Norte Smoke-Free Initiative, which is a subscript of El Paso del Norte Healthy Foundation. Uh, this foundation doesn't seem to have much footing and base over the issue. If anything, it's more online and voluntary access right through their own agency. Their posts are infrequent and are only occurring every 2 months to 3 months on some brief information, and it presents itself in a digestible manner. However, because of my own line of work and familiarity with the county and also the local mental health authority, I decided to reroute and suggest that this be a program instituted within Emergence Health Network, which is the local mental health authority and also the local intellectual disability disorder authority. This organization already has familiarity with helping children and family. They do have a substance program for youth already, and because they're already addressing these topics, it would just be another extension of their already capable reach. And because they're the local mental health authority, they have a majority of the cases. So if anything, we can be referred to them, since we do partner and network with the local authorities like law enforcement, JPD, and the county. The geographic area that it does serve is predominantly Hispanic. It's 80% Hispanic here in El Paso, and the agency, it does do mental health as well as the substance abuse that I just previously mentioned, which can include counseling, medication, inpatient services, acute patient care, housing programs, drug counseling, crisis intervention, crisis hotline, crisis services. To list all of them would be exhausting, so just food for thought. There's no program in place right now besides independent direct counsel care if substance is an issue. However, this can be a outreach program instead. So rather than trying to recruit and collect direct care clients and patients, what this would suggest is that we go out to the community and educate them, since they already do have a pretty well-developed community education department through human resources. This would just be more of a extension of their own knowledge, and then also what we can bring based on research from the WHO, CDC, National Institute of Health, and also Tobacco-Free Initiative or Smoke-Free Initiative. And going back to what was initially stated about the strenuous resources that are being pumped into JPD and the TDPS, this program would hopefully alleviate that while causing even an increase of resources to the community, so that whatever resources get saved and dispersed through JPD can then be focused on preventative and re-education of the community. This way parents can take the initiative and take those steps. This way it doesn't result in children having to go through through the criminal justice system, having to get their records expunged, potentially limiting future employment or opportunities or even financial aid, since we are a low-income city. So regarding the evaluation design and methods that I would implement, I would probably refer to outcome impact and cost benefit assessment analysis. This way we can see if the allocation of funds to these public interventions and conventions for schools, for parents, teachers, and those alike within their community will benefit, and if it will negate the amount of children that are going into the JPD system and having to do this diversion program instead. In reference to the literature review, there's limitations on what's already been effective. From what I was able to locate, there wasn't really a cost-benefit analysis, nor was there an outcome impact assessments conducted based around if community outreach was going to be a viable option to negate some of the usage of vapes and THC within children and adolescents. Separate of literature review that supports cost-benefit analysis or outcome impact, uh, reputable organizations that are global or international or national as well, such as the World Health Organization, argues that kids are being recruited and trapped at an early age to use e-cigarettes and may get hooked to nicotine. Um, Furthermore, CDC argues that marijuana may harm the developing brain since the brain is still in developmental stage, especially the prefrontal cortex until the age of 25. And the higher THC percentage, the more exacerbated this correlation is. National Institute of Health has also identified heavy marijuana use in correlation to intensifying mental health diagnosis and symptoms with that of depression, anxiety, suicidal ideations, and even psychosis. The term e-valley, which is e-cigarette or vaping product use associated with lung injury, was a term that was only created in 2019 due to the influx of lung injuries from these vape modifications that you breathe in aerosol. This was coined in 2019 under the American Association of American Thoracic Society workshop. And even other empirical articles and journals such as Wade and Bates displays that this is a double-edged sword, that ensuring no immediate action or prolonged action will yield unique problems for both the current system that we reside in and the future. So the research question I would implement to this design is, how much will it cost to effectively host weekly or monthly community events to service a minimum of 500 families or 500 individuals per presentation at high school? So the layout would be to focus around the 23 high schools that we do have within those 3 districts that I previously mentioned earlier, and then maybe work down into the middle school system, since we're seeing that a majority of these cases are coming from those in the high school age range, and then the second leading cause is also those in the middle school range, with few outliers in elementary. Some other research questions that can be used to address the outcome impact is there supporting evidence that shows a reduction of children in the JPD system because of the parents attending community information events? Or what is the number of parents who did or did not attend the community information program prior to their children's involvement in JPD? So if we're looking to service 500 to 1,000 people per event per high school, and there's 23 high schools here in within the El Paso city limits, then we're looking at anywhere from 11,500 to as much as 23,000 individuals that we're going to service. So we can't really do just a qualitative measure. We have to do a quantitative, which would require us to use mixed methods. In this instance, we would be assessing to see how many in-school or out-of-school suspensions there are, differentiate the ones that are nicotine or THC based, see if they did end up having to resort to the JPD program, or to see if they're under the disciplinary alternative education program for individuals who are caught with nicotine-based vapes while in school. This law was just enacted in 2023 under the 88th Texas legislature and amended to the Texas Education Code. To address the baseline, what we can do is rely on parent self-reporting, or also look at the statistics that we currently have available for the fiscal year, and then also look at some of the self-reporting by administering questionnaires for parents to complete prior to entry to the community outreach program. This will give us kind of an accurate reading to see, if there's children who are using these vapes but haven't been necessarily caught or involved in the JPD system. Then it'll give us a more accurate assumption or baseline level as to what the amount is of those who are within the system, those who are not within the system but are still currently using. School reports can also be used for children who have been caught using vapes while on school premises or during random dog searches. Because we're not doing a controlled environment, it's more of to see if the information that we're putting out is going to be resourceful. Instead of sampling, we would be examining the parents who did attend the program and are involved in the juvenile justice, and comparing them to parents who do not attend these programs but still have children in the juvenile justice program. And we could also look for recidivism if they are in the unfortunate event caught in middle school or early high school, and then once again caught in the later portion of their educational career while still minors. For this one, it would be convenience sampling, whoever shows up, and then we can with their permission or with their discretion, track to see what's going on with their child, see if there is any kind of recidivism going on in the future. If the parents want to reach out, or we can call and follow up with them to see if they completed the program, but yet they're still struggling with substance use or still continuously using regardless of the program information, and have not been caught. One of the biggest strengths about this is, like I said, there isn't really anything concrete in base. We don't have a designated center, we don't have designated programs, we don't have anything for parents to really go to and speak with someone or hear a presentation or anything like that, receive pamphlets or understand who to go to, where to go to, what their options, what their resources, and what their rights are. So this addresses a lot of those growing problems with this novel time of parents will be able to familiarize themselves with vapes as well. I understand that there's a lot of variations out there. There's some that look like highlighters, some that look like USBs, some that look like modifications almost, some of them that look like bike pumps. It's so many variations, and with that we can help the parents understand, like, well, why is he charging his USB, or why is he never putting down that highlighter, why is there so many, what's that odor that I'm smelling, you know? This could also count for accredited hours for those within the JPD system if they have to complete some community hours for either family or for child independently. It's a net benefit to the community and program with minimal expense if we're able to mitigate some of the costs of having them in private event centers and actually hosting them through the schools that we want to go engage with the families at. This allows partnership with law enforcement too, and as previously stated, it alleviates those systems that are already strained just because of the amount of influx of children who are getting caught. And it gives the children to be proactive in their decision and teach them on, you know, what the harms, risks, and even some of the benefits to them. And like I said, I use benefits sparsely. It's more to, you know, address, you know what, there is some euphoric purposes to it, and I understand why some individuals might experiment with it and even become an addiction to it. Going back to that previous point of the strength and also the limitation of it, the questions will be subjective, and that's why they won't be too reliable on they'll be much more reliable on data convergence, but it could also be for a number of reasons why there is still an influx of people going to the programs, but there's also an increase of people that are still getting caught in the JPD system. It could be law enforcement also improves their tactics, like Anthony Independent School District intends to put emission detectors inside their classrooms to detect vape odors and vape emissions. So there could be a number of things that can influence what our results are from outcome impact. And like I said previously, just because a child isn't in trouble doesn't imply that they're not necessarily using these vapes discreetly. Is an increase or decrease of child adolescence in JPD diversion program a direct relation or result from our public information outreaches, or is there a questionnaire that needs to be sent out to help identify what the cause for their sobriety or their continued use is? Some threats are the integrity of the program itself. You know, will parents self-report on their own children using, or if they're having trouble? Because I understand being able to raise your hand, whether discreetly or openly, is not going to be very easy coming for parents. We would need to work out some logistics, especially with the FIRBA Act, to identify and protect these juveniles. We're limited on the information we can gather. So seeing if there's a recidivism or reoccurring with the same, you know, parent or case number or anything like that would be kind of difficult, since we would have to work through so many systems with JPD and also the independent school districts of Texas. And also, is there a healthy bias, since most of the people who would attend this are invested, interested, and have a healthy mindset and want to try to be involved in their children, whereas there may be some parents who need a little more guidance or noting to go to these events. So there may be a healthy bias or limitation, especially on socioeconomic, how many parents are in the household, if there's daycare or child care supervision already available for them to attend alone or with children. Plenty of limitations. The findings of this study, if done corrected, would actually be very resourceful to Emergence Health Network, the organization, since they already do have school-based personnel within the El Paso Independent School District. They can then expand that to Isleta and Socorro. JPD, the Juvenile Probation Department, law enforcement, parents, the community, drug counseling programs that already exist in Texas or in El Paso specifically, counselors and mental health professionals who are dealing with co-occurring substance use disorders in adolescents or children as well could also benefit from this, and just the overall general community who can be more informed, more educated, and tend to the younger population with charismatic approach and knowledge about what some of these substances do, what some of the risks are, and how it can affect their development and also their physical and social and emotional well-being. Information can be shared in various ways, and for instance, this proposal through video, coming from El Paso, Texas, all the way to Arlington. Posters, seminars, press release, pamphlets, YouTube videos, or even maybe a TED Talk one day. So the value of this study is vaping is rather novel, and I remember some of the first iterations of it being when I was in junior high school in 2010 in the form of the notorious blue cigarettes. From that point, they've developed and evolved and have become reusable, disposable, and even discreet, as mentioned earlier, in the form of highlighters or even USB looking items. There's limited research, as noted throughout this presentation, but this program would allow that conversation to begin and inform the public of some of the disparities and gaps of research because there's no longitude studies from it. But it will keep them informed as the matters come out and as more information is published through the credible resources like National Institute of Health, CDC, WHO, and the American Heart Association, with many others. Vaping is not going to go away anytime soon. Just in the past, it has evolved and it will continue evolving. And it's important that the children and family are educated over some of the harms of vaping. And the findings of the study is only the beginning. This could also open up doors for future research involving long-term studies and seeing if there's a correlation of anything of children using vapes and THC at an early age into adulthood, and see if there's any development of mental health, psychosis, depression, suicidal ideations, depreciation, life satisfaction, career opportunity, or even other law enforcement run-ins that involve higher crime levels of drugs. So this is the good place to start, and because we would have this data early when they're still in high school, middle school, and under their parent supervision, we can see what real resources are needed and how the program could have been improved in history and changed to modify today, this way to negate some of these instances that we're running into with people in the law enforcement system.